Exposing a healthcare crisis here in Indiana, a severe shortage of home nurses. Now that crisis has gotten worse because of COVID-19. Our senior investigative reporter Bob Siegel explains tonight why this problem is so tragic and why there is now more pressure on state leaders to take action.
Dear Governor Holcomb, 3 words families all across Indiana are counting on to trigger change.
What we know is that this is what Hoosiers want.
Evan Reinhardt runs the Indiana Association of Home and Hospice Care, and he's the one who wrote this letter asking the governor to take action.
Our ask here is that there be consideration for additional dollars to be spent specifically in home health services.
Home health services allow Indiana's most medically fragile kids and adults to be cared for at home with a nurse or home health aide.
Make a sound if it hurts and I'll stop.
The state has already approved that care for thousands of families, and Medicaid will pay for it. But there are not enough nurses to go around. State leaders get to set the reimbursement rates for home nursing care, and they've set those rates so low for so long, there is now a critical shortage of home nurses in Indiana. It means families often wait weeks, months, even years to get the home nursing care they're supposed to get.
We are suffering, and our kids are suffering, and it's unfair.
Some families say they have no choice but to send their loved ones to a nursing home.
And now my daughter's gone, when she could have been home here with me.
And there are countless Hoosiers in nursing homes who could be home instead.
There is no medical necessity for me being in this nursing home.
Jim Agater talked with me from a Greenwood nursing home where he says he does not need to be.
Basically, I just taking up space, and that's costing a whole lot of money.
Jim was born with cerebral palsy. He needs help to get in and out of bed, to get dressed, and to use the restroom. But for years, before the home nursing shortage, he was able to do all of those things at home with the help of a nurse.
Once I'm in my power wheelchair, I could pretty much do anything I need to.
But now, instead of paying for Jim to have a few hours of home nursing, Medicaid is paying for Jim to live in a nursing home. A lack of home nurses means a lack of choice.
Where would you rather be right now?
That's a no-brainer. In my home or in the community.
But state leaders continue to spend the vast majority of Indiana's long-term care dollars on nursing homes, not on home nursing. In fact, during the pandemic, the state has given nursing homes millions of dollars in rate increases to boost nurse salaries and pay for more protective equipment. Home nursing agencies have gotten nothing during the pandemic.
The only group that's received an increase are nursing homes.
You cannot just pick one winner or loser in an industry. You have to spread the money evenly and where it's actually most effective.
Nikhil Ganali runs a home health agency in Indianapolis. He says the state's low reimbursement for home nurses has made hiring just about impossible.
I feel like almost the system has stopped. The number of applicants coming in or even contacting us or we're able to contact has just fallen off a cliff.
Thank you for calling TenderCare. This is Maria. How can I help you?
Other home health care agencies tell 13 Investigates the same thing, and they say the crisis is getting worse.
Patients are dying because we don't have the appropriate level of care for them.
The healthcare system has forgotten that home care is the least expensive, most preferred form of care.
That's why the state's home health care industry just sent this letter to the governor, asking him to use some of Indiana's $2.6 billion in federal CARES Act funding to increase rates for home nursing. It's something other states have already done, but not here in Indiana, which is one of the worst states in the nation for spending on home health care.
So pretty much we're kind of stuck.
We want individuals to be able to live out their days where they prefer, not where they're, kind of forced to go because of a lack of options.
The governor and state agencies have been reluctant to commit more money to home nursing care. In the past, telling 13 Investigates an increase in Medicaid pre-authorization rates, well, it's something they would rather not consider until next year. As far as this letter, the governor's office will say only it is reviewing it.